in. All right, thank you everybody for joining us for our weekly Lunch and Learn. I've lost track of what week it is now. It might be week 9, week 10. Just completely lost track of time in general. But we're excited to have you all here today. We're going to be talking about return to work policies. We're joined by Angie Weimer from the NALEO Fund. Looks like I left off NALEO Fund on here, sorry about that. And Rodney Bolton from HR Biz. We're also going to be sharing the results of a return to work survey that we conducted with 100 local nonprofit leaders last week. So should have some good trends and an idea of just kind of where everyone's pulse is right now. Before we dive into that though, just wanted to make sure that everybody here is aware of some of the resources that CNM has available for you right now. Most of these are available on our website at our COVID-19 page and our events page, but in short, we've got free 15-minute open office hours consulting appointments with our expert nonprofit consultants that are ready and waiting to answer your questions. We've also brought back our education, training, and certificate programs that are all virtual now for the time being, and have a number of exciting programs coming up. We also have a whole bunch of great COVID resources on our COVID page, including our nonprofit helpline, recordings of all of the different webinars we've done, including HR questions, PR questions, PPP questions, all the acronyms, we got them. And we do have a number of upcoming events. Most particularly is our upcoming annual virtual conference, which is going to be June 2nd through 4th. Regina, maybe you want to tell everybody a little bit about that and why they should come, and it's going to be so awesome.
Well, it's going to be awesome because all of these people that are listening right now and hundreds of others are going to get together for 3 mornings in June to think together about what we can do as organizations to help communities. We know that there is a lot of big decisions that are coming. And so what we thought is we would take our annual conference, make it virtual, make it easy for all of you to attend. We're going to do it in 3 parts because we know it's really hard to leave the office. Even virtually for a couple of hours, but hope that you'll spend 3 mornings with us. It's going to be the usual, getting some inspiring speakers and lots of breakouts and lots of conversations with peers, and then some challenges for all of you to think together. So we're really excited about it. I think it's going to be very responsive to what's keeping you up at night right now.
Absolutely. And one more point to throw in about that too. We know everybody's really busy. And so even though it's spread out over 3 mornings, everything's going to be recorded and all recordings are going to be made available to all participants after the fact. So if you can't make one day, if you're busy on one morning, we're trying to make it easy to get you as much content as we can and be easy on your schedule. We also have a couple of cool virtual seminars and certificates coming up. May 28th, next week, we're doing a trauma-informed response seminar that's going to be great. And then the other side of our conference, we've got a Beyond Diversity Checkbox Certificate, which is going to be a great DEI leadership program that'll meet over a couple of different sessions. And with that, let's dive in. So Regina, want to take it away and talk about our survey and what we learned?
Sure. So last week, as the county kind of moved into the 2nd phase, we thought it would be important for us to find out what you were all thinking. We know returning to work is as much about how to prepare your workplace for safety, not that all of you aren't working, but also how to prepare your workforce, that this is going to be a process, and that some of it is based in fact and some of it is based in fear. So with all of that in mind, we thought it would be interesting to see what you're all thinking, how you're handling this. So as you're thinking about moving back to your offices, what sort of challenges you're anticipating, and then what you're thinking about to address those challenges. So I thought we'd share some of what your peers are saying, help kind of level set what Rodney and Angie are going to talk about from the employer perspective and from the consultant advisor perspective. So we asked, you know, how ready are you? The other, that 25% over there really says either we won't go back, that we're not going to return to where we were, or that small 2% never closed. It was kind of a mix in there of we kept working. Our people are in the field because of the kinds of services that we do. Some were ready in 2 weeks, some said a month, and then you'll see a quarter of you said not till January.
Mm.
So we gave you options, and you'll see that a lot of sort of all of the above in terms of how are you going to promote physical distancing. So that kind of staggering schedules, teleworking, the rethinking your workspace are all, oh, somebody just asked, what's the sample size? We had 100 organizations. It was quick. We gave everybody 1 day to answer. We just wanted to get a sample, and usually what we find is these trends stay pretty true. So combination of limiting staff hours, staggering schedules, looking at how you're changing your workspace, and then you're seeing the big spikes in all the kind of virtual, online, teleworking strategies that we've learned that we can do in some cases. What we heard from a lot of people is they were surprised how much was possible virtually, and then where you'll see later where there were still some concerns about it doesn't work for our service area and our people.
Mm-hmm.
So we asked the question about reducing the number of visitors. You know, part of this is kind of a crowd control, physical distancing challenge, and most of you said that you would just limit the number of people in the building. That you would provide more services virtually, and that areas like waiting areas, parking lots, playgrounds, all of that stuff, really sort of managing the crowd.
Mm-hmm.
And then we ask questions about, you know, one direction pathways. You know, you guys also said that that was something, but also 20% of you said, we're going to do all of it. So we wanted to get a sense of, you know, how do you handle the kind of sanitation, cleaning, disinfecting. This one seemed like a no-brainer, which is basically that you're going to do a lot more cleaning, and that one of the issues was how do you pay for all this stuff? But a real commitment to working with your team to figure out how to disinfect, how to, you know, signage around printing areas and coffee areas where, you know, wipe it down, have hand sanitizer everywhere, wipes everywhere, that sort of thing. Mm-hmm. So, all right, onward. And then all of the above once again. So we asked the question about, you know, sort of access to the restroom, both for your team and then also for the, you know, if there were ways to keep your staff separate from the public and all that stuff. So access to, yes, that you were going to set up systems to allow access to bathroom breaks. This again was as much about rethinking, you know, numbers of people in a small space at the same time and how you were going to kind of keep the count down. As much as cleaning. So I told you were at 60% of you said that you were going to keep staff and public restrooms separate. So, you know, we're all kind of asking the question about systems that can be set up for employee and visitor wellness. You know, this one, you know, Rodney, it'll be interesting to see what you're thinking about this, what some of those protocols are going to look like in terms of people not coming back to work if they have a fever, cold symptoms, feel flu-ish, some people taking temperatures when you walk in the door. And how employers are going to take some responsibility for that, and how employees need to take some responsibility for that. One of the things that came up was how nervous people were returning to work because you could be asymptomatic and still be spreading the virus, and how to be in the workplace with people.
That's it. That's the end.
So with that in mind, a couple of things that came up that were kind of in the open-ended questions, and I thought I'd turn it over to you, Angie, as an employer, and then you, Rodney, as a content expert here. You know, some organizations were just really afraid that given the work that they do, it's not possible. You know, if you work with little kids, if you work with the mentally ill, if you work with people that don't have access to the latest protocol information, that might be difficult. In other cases, they really felt like there were some budget parameters that they were going to have to figure out what was possible, what was the responsibility of the employer versus the employee, and that all of this was going to take adjusting. You know, that it was going to be emotional. This is a pandemic. We've never dealt with this before. That some of it, you know, employers have to be sensitive to really individual circumstances around little kids, taking care of older adults and family members. All of it just kept lining up that there was the sort of workplace tactical, and then there was the workforce emotional,
Yes.
as much as the sort of pragmatic. So really glad that you guys could be part of this conversation today as leaders are thinking about preparing for probably what's going to be at top of our minds for the rest of 2020.
Right. Yes, thank you, Regina. Uppermost in our minds as an employer is the health and safety of our staff. We have managed to keep everyone employed at the same level. We've had to change a couple of positions and rework assignments, but everyone is the same. I think we are in a interesting situation because our headquarters is here in Los Angeles. We're a national organization. And so we have offices in New York, DC, Orlando, Houston, and Phoenix. So while we are abiding by the Los Angeles County order, as it is more protective of the workforce, we ask all our offices across the country to do the same. As you know, New York has been hit badly by the pandemic, and so all of our workforce there is working remotely. They're being very cautious even to go into the office to get deliveries or mail, for example. Other places like Houston may not have been hit as much, but nonetheless, they're following the dictates of our order and staying away with having a few staff come in from time to time as needed.
Angie, how did you decide? One of the questions, or at least one of the concerns and fears that people mentioned in the survey was, you know, different direction from different stakeholders, the governor, the county, the city, working across counties, that people were not sure who to listen to. So how did you guys decide which guidance was going to lead you?
We decided to follow the guidance that was more protective of our workforce. So if the order was longer, we took that because we felt that was in the best interest of our team and our team members. And then you touched upon the issue of wellness and what folks were feeling emotionally or mentally, and we take that into account from the beginning. We advised our staff that as of March 16th, everyone was working remotely. Since that time, every week, we meet as a group every week. We meet as a senior team every week, and we provide resources to all our staff in terms of articles, best practices, what to think about, how to be prepared, how to prepare yourself, and for wellness as well. And we've also hired a actual mental health therapist to conduct a counseling session for our staff, and that's going to happen next week. So along with the regular workplace issues that we have, we're also managing or hoping to manage our workforce mentality, if you will, and wellness, because that's very important. But I think I shared with you, Rodney and Aaron, earlier, one of the biggest challenges that we have is getting our PPE and having all of that available for all our offices. And go ahead, Regina. Oh, I can't hear you.
Yeah, there's two things that I was nodding. Yes, that what we're hearing is sort of that whole employee assistance piece around the mental health side.
Yeah.
That people are afraid to talk to their supervisors about things that are personal. And that some of this is really triggering issues that, you know, are just hitting people in a lot of different ways, and how employers need to think about talking about this appropriately, but at least opening the door, which sounds like you've done, to just say this is real, and the anxieties are real and the fears are real. And then, you know, on both sides, that's why I was nodding, both sides, either that organizations got the paycheck protection dollars or they didn't. You know, if they did, that was kind of a life raft for 8 weeks. And if they didn't, that was one less thing that was available to them. And then what other choices are coming up for, you know, nonprofit organizations. So yes, yes, and yes.
Yeah.
And I think one of the things that we've done is we have developed an addendum to our employee manual, our policies, that we will be having staff sign that outline all of the particular needs and protocols given the pandemic that they would need to follow, which includes the FFCRA availability as well, Fmla Extension as well as all of the health protocols of disinfecting and the like.
Yeah. We're getting a lot of really good questions in the chat, and so please keep adding your questions. Rodney, I want to give you a minute or two to speak, because I think you already had some good answers to some things that were coming up before. But after that, we can circle back to questions, and would love, I think, right before the whole call started, we were talking about, you were mentioning Ppe Grants, and I think that would be a really interesting place to jump off.
Yeah, well, I want to first off just start by thanking you guys for having me here today. And I'm Rodney Bolton from HR Biz. I'm a human resource consultant that provides HR service, my team and I, throughout the United States. I was really glad to hear Angela's perspective, because most employers have not been as open with their employees. So one of the things that's really important is that everyone look to develop what their policy and what their procedure is going to be moving forward in a new normal. And so really what that consists of is actively encouraging sick employees to stay home, making sure you have a flexible policy, that you're familiar with the FFCRA, because that's an extension of FMLA. And clearly, if someone needs to stay home, the last thing we really want to do is not encourage them to do so, because it creates more, as Angie was saying, issues regarding the mental health segment, right? And then I think it's really important from there is, do not require employees to have any type of healthcare provider notification, right? And because of the number of people that have contracted, been in close contact with COVID, CDC says that by the end of next year, 95% of all our population will have either been exposed, tested positive, or in some way affected by COVID. I don't know where those other 5% live. They're probably in Alaska in the lower or something, but I would think 100%, but that's what the CDC says. So to piggyback on what Angela was saying is, or Angie, that's very important that you have that policy. You don't require a note. You maintain flexibility in your policy, right? And that you encourage people to stay home. So the question always comes then, how can an employer continue to do all of this and meet the bottom line? You know, everyone has a budget, et cetera. So to answer Aaron's, his statement is I would first check with my workers' compensation insurance carrier. Many of the workers' comp insurance carriers are providing either a $5,000 or $10,000 grant, right, to be able to purchase PPE. Second off, every one of the workers' comp carriers were informed by the insurance commissioner to provide rebates because we're not using the policies. We're not driving as much, people aren't at work, etc. So there could be some negotiations there where you would contact your underwriter, contact your broker and say, I know I'm getting a rebate, but maybe I can exchange part of that for the grant and I could use that money for PPE. So that's something that's super, really important, okay?
Very helpful.
Yeah, it's going to be very helpful. If anyone has any questions, Angie, I'll reach out to you after this. But if anyone else has questions, you can go to these guys, you can reach out to me and I can help walk you through what to say if they say no, because that's really important, right?
Yeah.
The next thing that's really important is this. How does this affect our workers' comp? Is this a workers' comp claim? Is it not a workers' comp claim? So ideally, if an infection occurred as a result of, or transmission, something that happened at work, it is an OSHA recordable incident. So what we want to do is really be careful that we're following CDC protocol. But if something happens, and things are going to happen, you do want to note it on your 300 log and your 300A moving forward, right? And this is going to be critical in case OSHA comes in and wants to do an inspection, because they say under the general duty clause for OSHA 5C, it is the employer's responsibility to maintain a safe and healthy work environment. So we have a lot of clients, for example, that provide medical service and mental health services. They cannot avoid providing these services in this time. But with that said, they're subsequently exposing their employees, right? So what we tell them is have your protocol in writing. What are they supposed to do? Are they supposed to wear PPE, social distance, wash their hands, cover their eyes, provide PPP for the affected party, etc. Whatever you're going to do, please have it in writing. And it's extremely important to remember that everyone should have an injury, illness, IIPP, preparative, right? Preparation. So it's called IIPP. It's the law, right? But the new normal would be the IIPP should have information regarding COVID, right? And coronavirus, and how would we treat it if an employee says they were infected? And lastly, before I turn it over, remember, the CDC is expecting every single employer, small, medium, and large, to prevent the spread of the disease, right? So one of the things that people ask me all the time, well, I'm afraid to violate HIPAA. This may be a HIPAA concern. So I'm going to just clarify that. There's no HIPAA concern with COVID because the CDC has determined COVID is a temporary disability. It works just like any other temporary disability. Pregnancy is considered a temporary disability. A cut in the hand is a temporary disability. So since it's no longer considered to be a permanent disability, right? You have a lot more freedom in terms of what you can do. What that means is you can ask the person to can you take their temperature? You can request them to wash their hands, right? So they're giving you a lot more leeway, right, in how to combat this disability. And I'll turn that back over to you, Angie.
Yeah, exactly. I think that's right on point, Rodney, right on point. That's why our policy addendum is very specific and detailed as to what is expected and required of all our staff. And they will sign and date that as an acknowledgement that they've received this and will abide by that.
You know, one of the questions that's coming up is kind of linked to this around privacy, you know, how you protect the privacy of your employees, but then maybe treat some people differently based on their needs, whatever alternatives you come up with for them. Is there where's the line in that? How does that work? And they also asked about how OSHA works when people are working at home, given
Yeah.
safe, but in a place you don't control.
So it's a temporary disability. So since it's a temporary disability, the bar for privacy has been lowered. So what that means is it's not subsequently at this time covered by the ADA, because in that particular case, if it was covered by the ADA, they would have the right to inherent privacy. Let's say, for example, if it was diabetes or anything, as the ADA says, it substantially limits one or more life function, right? This is a temporary. So this would be equal to what they're saying, the CDC, H1N1, a cold, a flu, pregnancy, anything that's temporary, right? The bar is much lower in terms of privacy, okay? That's one. And then two, what's really important for the second part of your question is that it's really important in terms of the OSHA aspect of working at home is the employer does have some responsibilities for safety. And one of the things I always tell employers is to make sure that they go back to their work comp provider and see what their coverage is for liability insurance, for general liability insurance, right? How are they covered there, right? Also, do you have a work at home written policy for every employee? Angie made a really good point. She says, I have clarified with them what the supervisor should do, and it's in writing and they know. That should be extended to everyone, right? If you're working at home and you don't have an employment policy or an agreement with your employees, you're subsequently asking for trouble, because the thinking there is ideally that the person could mix what is working and what's not working. A case in point, I'm self-employed, but this morning I was out watering my grass, watering my yard, right? If I was working for someone, is that covered, right? If the policy doesn't specify, you can believe that if they, gosh forbid, anything went wrong and they had an aggressive plaintiff attorney, they're going to say, oh, no, you never had a policy. So your policy should specify what you consider work. Like Andrew was saying, we list what we have. What they do from work, we list that. So if a person is cleaning the garage, or I won't say watering the grass since I was doing that, right? Or dusting, or repairing something, that it's really clear in your policy that that's out of the course of normal employment. And I think the acronyms for that are AOE, COE, not in the course of everyday employment, right? But you can virtually assume that if you don't have a policy specifying what their duty is, then you're going to have issues. And the last part I would say is I would ask the employee to take a picture of their home site, right? So that you could look at the home site and see if there's anything that could be an impairment, right? So maybe you can make a suggestion, right? And then I would, the last thing, and I would also make sure that that is included, right, in their agreement that they have with you and the safety manual. Now, I'll pass it back to you, Angie, because I really think they should hear more about what you guys are doing with the whole having the understanding of employees. I absolutely love that.
Well, thank you, Rodney. Yeah, one of the things,
Yeah.
in addition to the addendum to our policy that is specific to COVID, we have had in place a telework working remotely agreement for those employees who are working remotely. Now everything has shifted. Now everyone's working remotely. So we're having everyone sign this working remote agreement. Previously, Rodney, as you said, we have had pictures attached to the agreement, photos, if you will, of their workspace. And we have gone so far as providing equipment to staff who may not have the proper equipment to work from home, whether it be lighting, whether it be a chair, whether it be even a desk. We provide them if we are requiring them to work remotely for our organization. So those are two things that we get signatures from our staff.
Yeah, I personally, I tell you, I can't tell you that I just think that that's perfect, right? And I also tell people, and this question gets asked every day to me, right? What am I going to do if my employee gets an injury, right? What you're going to do is the inverse of that. You're going to prepare prior to, because injuries will happen, right? So that the employee knows the risk. And if you have a safety consultant or if you have an HR, I think that it's really good business practice to get on the Zoom with them or wherever you want, get on a Teams with them, not to just promote Zoom, get on a meeting with them and really discuss what's the workplace impairments. And then another thing is they'll also discuss with them safety procedures, because the notion that they can't contract COVID at home, maybe they go to the mailbox and pick up a package, or they get a box from Amazon, etc. They need to know that how would they treat that. You know, maybe it's a work package. We had to send 4 boxes of Amazon to a client last week of personnel files that we audited. And one of the things I put right on top of them, I had the office put right on top of it, this is what you want you to do. We want you to open it, remove it, throw the package away, wash your hands, let it sit for 2 days. And I think that needs to go in employers' safety provisions as well, because we don't want to operate under the inherent assumption that ideally you can only contract this, you know, while out.
Right.
There's interaction with other people.
A couple of good questions popping up about remote working agreements and all that. One, any good templates that you can point people to out there that they can find as reference for creating these remote working agreements? And sort of follow up to that, talking about covering you know, desks and chairs and all that, are you required to cover the cost for that? And sort of who pays for that policy?
Okay, you guys go ahead. I can, if who wants to go?
Well, we've covered the cost for our staff who need that type of equipment. We haven't luckily experienced when a staff leaves and how we're going to get that desk back, or if it's just, you know, you take it and it's yours now. The chair is yours, the desk is yours. Of course, equipment like laptops and monitors and printers, those are returned to the office. But we assume the cost for those things. In terms of templates, I had researched a working remote telework template years ago. And one of the things that we always do is we look at the template, we fashion it to our needs, and then we have our counsel review it. Every document that goes to our staff is reviewed by counsel before it's finalized, before it's soup. Counsel has to look at it.
Yeah, and one of the things we do is, because I actually provide information to the CDC as well for employers. I do some consulting with them. If you go on their website, you will find more return to work information than you can imagine. So what I would recommend is that you take a standard work at home template, right? And then infuse it with the CDC guidelines, because some organizations don't have the luxury of having able to use outside counsel, right? And sometimes another thing is that the situation is so fluid that even when we do have, and not to contradict you, outside counsel or HR looking at it, it's so fluid, things change every day.
Right.
So you could really help out a lot because they could okay it and then tomorrow it's different. So one of the great things you can do is go to the CDC website, and it's not tertiary information, it's primary information, right? And sometimes tertiary information can be misconstrued because it is the second line, right? And that would be my recommendation. You go to the CDC, look at what they have. They have tons. And again, you have to lean on your work comp carrier, because your work comp carrier is going to have a tremendous amount of information on their website. I know State Fund does, Berkshire Hathaway does, Zenith does. So they will have most everything you need on there.
Awesome. A couple more follow-up questions for you, Angie, on covering those costs, and then some good questions on kind of staggering return to work policies. One question on the remote setup. Do you have a max budget or a cap for those? Do you have you needed to, or has it just been kind of on a case-by-case basis and hasn't been too extreme?
It hasn't been too extreme, and it is on a case-by-case basis. We rely as a nonprofit on a budget that's approved by our board. So with this COVID-19 situation, we have had to redo our budget and have our board approve a different budget moving forward, given the needs that we have to meet for the pandemic and for our employees in offices. One of the interesting things is we're headquartered in Los Angeles, and we work in a building where an urgent care is right across the pathway from us. They're in full PPE with tents out and taking temperatures and the like. And then across the hall from where we work is LabCorp, who's testing various specimens of note, we don't know. And then on the second floor is Social Security. So we have quite a lot of
Wow, okay.
Yeah. So you can imagine that that has prompted a lot of concern and fear by our staff to return to work and be met with all of these other folks who may have a higher risk of COVID-19. So most of our staff is working remotely, but for some. So in terms of staggering, to your question, we don't really need to do that, but we have implemented a policy that there will be no more than 10 people in our office, our headquartered office, and those 10 people work pretty much 2 days out of the week, and those are staggered through the week. For our smaller offices, we'll have only 2 people in the office at one time, for example, and then they determine through their own directors, who goes in the office for what, and only for essential reasons, essential issues. One
more question. Yes, thank you. One more question on remote cost covering. A couple people asked about, laws around cost of electricity, internet access, cell phones, calculating percentages. How are you guys handling that?
So I get a lot of questions regarding that, and right now there's no official mandate on covering it, but I would 100% adhere to what Angie's saying and acquiesce there, in the sense that I would keep it very loose, that if an employee simply wanted to turn in a reasonable request for reimbursement, to reimburse them, right? Because the concept there is that if you maintain a really great rapport with this employee, right? In essence, you're building a culture that people will work harder for you at home. So, and I also would adhere to what Angie's saying regarding the furniture. The same thing, that if they had to purchase a desk, it's going to be a lot cheaper to buy a desk or to pay a work comp bill, right?
Yeah.
Right, exactly.
Yeah, and so that's why I'm 100% forward a human approach, right? And now there's always going to be people who are going to look to take advantage. What I do is I would amend the hire packet. And in the new hire packet, when you list all the items that a person received, right? I would have everyone sign it, even if they had to use DocuSign, right? And this way they know that the property belongs to the company, and that part of them exiting the company, ideally, they would have to subsequently return whatever is that was administered to them. And so it's
Well,
just,
Rodney, I'm curious, since some of the people that I'm looking at here, it's some small organizations, as they're thinking about their new fiscal year, and who knows how long this is going to go on. I'm wondering how are you seeing that employers are, I know I've heard from some of my colleagues, you know, they had to have a phone anyway. Everyone has a phone. Everyone has electricity anyway, you know. How much is the employer responsible to reimburse? Or if there's some sort of a allowance, you know, that goes across the organization that says, now that we're all working at home, everybody gets $25. I mean, I just know, I'm listening to what you're saying, and I'm thinking about what some of my colleagues have been talking about, and they're trying to plan for the new fiscal year and be fair right now. And I'm just curious how people are dealing with that and worrying about what their budgets are looking like in this really volatile economy. You know, so we've got the health piece, and then we've got the economic piece, right?
Well, if I may, Rodney, one of the things that we did and what we have is a cell and internet agreement policy. And what we've done is we've given staff a flat rate for cell phone use and for internet. That is the easiest way. We tried it once years back to section out their phone bill as to figure out what was work, what was personal. Put that away. That's ridiculous. And I'll tell you, for an HR department of one, I have far more things that I need to worry about than start analyzing that. So it was easy to say, okay, $25 for cell, $50 for internet. Your monthly stipend for that is $75, and everybody gets that.
yeah. And Regina, and that's exactly what I'm saying is I love Angie's approach there, because ideally it's really lends itself more to showing flexibility as opposed to one size fits all. So if they don't have it in their budget, maybe you can't do it. But that's when I would engage in a conversation with the employee and just let them know. And what I do, to Angie's point, to split the compensation, we go, there's 24 hours in a day, you're gonna work 8, then we'll pick up 1/3 of your cell bill. And then maybe put that in writing. So I look at, when we do a policy for a company, what's the logic and the intent of the policy? And so if you look at it like that and you're paying, you know, 8 hours, which is 1/3, you'll always win, because the assumption is you probably make more calls during the 8 hours anyway, right? And then if an employer can't pay, we're urging them to ask the employees to use the Zoom video audio feature. Because you're already paying for Zoom, then say, okay, you don't have to use the cell phone, use the Zoom audio feature, use the Ring Central audio feature, or use the Google phone, right? So this whole concept that we have to use our iPhones or our Droids, right? Really, it's just based out of habit, as opposed to looking at what is the creative solution to that.
And you know, you bring up a really good point, Rodney, in terms of using Zoom. So now we find that we need to train our staff on how to be more tech savvy, now that we are forced to be tech savvy. So that's another little hurdle, you know, and training that we need to provide.
Yeah. Question here that I think would be good for you, Rodney. Tips for managing up if you're an employee and you're seeing that your employer does not have policies like this in place, whether it's reimbursement, but probably more on the remote work agreement side.
So this came up actually last night at about 10:30, where an anonymous person reached out to one of my staff members, and they said not only didn't they have policies, they had nothing for COVID prevention and care, et cetera. So I think that there you have to always go to the highest person in charge. Either it's the CEO or the head of the board, and have it a top-down policy, right? But what you always want to have is you need to have a lot of visual reminders of the state that we're in. Like, does everyone have a sign prior to entering the facility, where they're entering, what's going on? That's a requirement, right? Do you have things posted at people's desks? That's a requirement. If you have the ability to have, like with your payroll system, if they go in and use Paychex, Paylocity, ADP, you could have the screen set for, this is a reminder to do this, this is a reminder for this is what you should do, right?
Oh,
And
excellent point, Rodney. Write that down.
so, yeah, and so whatever payroll system you have, and I do that for people all the time, I'll say, you know what? You need to change the homepage, right? You need to change the homepage of your social media, of your website. So in the end, this really boils down to communication and transparency, because we're actually building the bridge as we walk on it. So if that be the case, right, there's few people who absolutely know everything, right? And so I always recommend, then let's start with communication.
And then with regard to communication, that needs to be repeated, you know, consistently. Even though you've sent the memo, you've told them at meetings, send it again, send it periodically, always.
I like it.
We had some good questions about staggering employees when returning to work. Appreciated, Angie, your description of, based on the site, you're limiting the number of employees. There were a couple of questions about, the nitty gritty of how to do that, and like who goes back when, and is it better to have, a few people 5 days a week or more people for fewer hours? And just like how you go, some people will stay working fully remote, some people will be coming in, and just how do you go about slicing and dicing that?
Well, that's something that falls on my plate to coordinate. And I'm fortunate, or we're fortunate in that most of our staff are now working remotely. So there are very few staff that I really do need to coordinate. I'm lucky that our directors in our various regional offices will be doing that. We've heard from them in so far as who on their staff needs to come in, and we're letting them decide and coordinate at which time. For our office in Los Angeles, for example, we have a daily schedule of who's in the office every day, along with, who's out, who's on vacation, etc. We've gone in preparation because, we were hoping that the order would have been lifted May 18th, and it wasn't. But we had gone into our LA office and cleaned it and put distancing tape around certain offices, signs up, PPE at various stations in preparation. We did not have to do that for our regional offices because they are all working remotely. And we're getting ready to ship out PPE to those offices in anticipation of the lifting of the order. But, as Rodney said previously, it's all in the preparation. All of this was unprecedented, and it caught all of us by surprise. But if we are prepared, if we do the documents, have them reviewed, we have any number of eyeballs reviewing all our documents. I may prepare wonderful documents, but I have our COO look at it, our CEO look at it, and if it needs to be signed by we're lucky, pro bono counsel, she looks at it as well to make sure all our T's are crossed and I's dotted.
Mhm. Yeah, and I want to just add to what she's saying. Another thing that I look at in terms of staggering is what area is potentially the most dangerous
Mhm.
for continued transmission of the disease, right? So if we're looking at assembly line and everyone's working together, right, then I'm going to pay more attention to that as opposed to a clerical pool, not because I place less value on the pool, it's because it's easier to social distance them by moving them 6 feet apart as opposed to moving parts of the assembly, right? So I look at the area that would have the highest exposure with people working together out of job necessity. And that's how we determine, you know, how to reopen safely. And some of the things that you could do there is that maybe on a normal process, there would be working on something that required them that this goes from A to B to C. Maybe we could have A and C working, right? From 4 to 8, and then B and D working, right? From, let's say, 8 to 12, you know, varying the times that they start in the morning. So really look at the area that they're in, right? And two is don't just limit sanitation areas to the entryway. They're required at the entryway, but they could be placed throughout, you know, and then the signs should really be color, right? I went into an employer about 2 weeks ago, tons of signs that are all 8 by 10s or 8.5 by 11, and they were black and white. You know, you can get your carrier to give you large signs that really display, right? And then I
Catch
also
your eye.
catch the eye, right? And then engage in some interactive communication, right? Because if you look at unilateral communication, it basically is just going to address what you are saying and what you think. But when you start engaging them and say, hey, Regina, how do you feel in the workplace? Where do you think we can improve? And by the way, Regina, what's your understanding, right, of these guidelines? Then it becomes very interactive. And I would engage in those processes constantly henceforth.
Mm-hmm. Exactly.
Yeah. One more follow-up question too on sort of additional considerations when you're starting to stagger employees coming back. How do you deal with employees and offering alternative employees for those who may have health issues, either themselves, taking care of family members while still protecting their privacy?
So if I may, on that one there, I think I would refer to the FMLA extension, okay? And because I think it's really critical that we understand that they're going to be protected because you're no longer required to wait 1 year before a person receives the FFCRA, right? It's 30 days. You have the benefit of staying home to care for someone who's sick, someone who has been exposed, etc. And I think the last thing is an employer wants to do is engage in any activity with an employee that's prohibited, right, by the FFCRA. So that's really critical, right? If you know they're covered, or if you have questions, right, I think I would run to HR and say, hey, is this person covered? That's the first thing you want to do. Find out if they're covered, right? Because if they're not covered, if they are covered, and you ask them, well, no, I want you here, and you should be here, and there's no exceptions, and then they go home, and then they come back to work infected but asymptomatic, then the employer has done really an injustice in that they did not prevent the spread of the disease. So that's critical. Find out if if they're covered under FFCRA. And that's really crucial.
We have a lot of staff who have children, young children, kids in high school, And the recent regulations provide very well for them in terms of their ability to take time off, because it's very difficult right now with everybody off, including schools, and now families are finding that they are the teachers and they are the caregivers day in and day out, when they once had to rely on those schools. And so we are particularly sensitive to those challenges of our workforce.
And into that, Aaron. So I noticed that one of the questions is that an employer did ask, how are they going to deal with the plethora of rules and regulations and really remain financially compliant, right? Under those type of cases, I would really, again, look to the work comp carrier, see what they're going to pick up, look and see what type of grant programs they're going to have. I would also look at the fine print of the PPE to determine, is there a provision where you could use part of this as loan forgiveness, not only salary, because you do have 25% other things like mortgage and utilities. Maybe they could shift some funds. And then lastly, I would look at how could they even make some of their own PPE. I have an employer that really is unable to afford anything during this time, right? And what I suggested to them to do is, let's start making your own PPE. Let's go to Smart and Final, and let's get alcohol, and let's get the necessary aloe.
Aloe vera.
There you go. And we started making PPE, right?
Well, you know, an interesting thing, early in this pandemic, when we were all made to work at home, one of the things that we did is we prepared a care package for every single employee that had a couple of pairs of latex gloves, a small hand sanitizer, and a cloth mask. And that was very much appreciated by all of our staff. There was no this little anecdote, there was no hand sanitizers to be found anywhere, but my assistant was able to find hand sanitizers at a CBD shop near her. And she texted me, she says, should I buy this? This is where I found that they have enough for our staff. I said, buy it, go ahead. It meets the requirement of over 60% alcohol or 65% alcohol or something like that. So it's great.
Yeah, and not to go too far offline, you could go to YouTube and you'll find a ton of resources how to take something as simple as a bandana, right? And fold the bandana in such a way in an internal fold, right? And create a face guard, just that simple.
There you go.
And I keep this with me at all times. This is like the new norm now, right? Because
very stylish too.
The law that says it has to be N95, it says cloth. So if you can get any protection.
Hey, Katie.
Huh? Any protection works as protection. So I would encourage people that are strapped on the budget to really do more networking. Find out what other people are doing. How can we make PPE? How can we use our own bandanas or shirts, anything, right? And social distance, right? There's really not a great cost for moving desks, you know, especially in this space. We're not production. We're not producing widgets, right? So it's just simply moving desks, or let people start work every 15 minutes, right? So maybe say 4 people can start at 9 and 4 at 9:15 and 4 at 9:30. Then you completely avoid contact, right? So that's one of the methods. And Aaron.
Yeah, that's a great idea. We're very much nearing the end of our time. There was a couple more questions I wanted to get to before we wrap up. One interesting one that a couple people asked And I know that our CNM's Director of Operations, Linny, is on here as well. Curious if you'd have an answer to this, but Angie as well. Indoor air quality, air filtration, air conditioning. A lot of people that aren't going to be, don't have control over their building's facilities necessarily, but just kind of guidance on air quality and whether it's okay to use air conditioning, air testing, just anything in that realm.
Right. Well, we have a challenge in our building in that our building management isn't as responsive as we would like to be. So a suggestion would be to always be on them consistently, as professionally as you can, to ensure that they are replacing filters, because we are in a building, I'm sure many of you are as well, we can't open the windows, right?
Oh.
So, and then the other challenge that we have is if we have air filtration individually for some offices, it trips the circuit breaker of our building because far too many electrical things are attached. So that's a whole other challenge. But I would say be consistent with your building management. I have even offered and sent them best practices from other building managements from our original offices. If I see that they have some good ideas that our building management in Los Angeles can use, for example, and provide their tenants.
Can you speak to what some of those best practices are?
Those best practices are, as I said, replacing air filters, most certainly checking to see that everything is working properly. Perhaps, I think amping up the electrical, and I don't have a word for it, capacity or circuits in their buildings, for example. Our building management has been very good in ensuring that the cleaning crew comes twice a day to clean and disinfect common areas. We do that ourselves for our workspaces where we work in the common areas that we touch, for example, but it's good to know that our building management also provides that janitorial service.
Yeah. And let me just jump on that. I know we got a couple of minutes. I'm going to keep it brief. Another thing you could do is remove all the filters yourself and hose the filters down with a vinegar solution. So vinegar costs $1.50. You put it in with inside when your hose, or use it in a spray bottle and just simply clean your own filter, right? And the CDC is saying that that does a lot to clear airborne pathogens, right? And another thing you could do is see if you have a HEPA filter laying around, right? I know I have a couple laying around from when my daughter was young, and I loaned them to a couple of my clients, right? HEPA filters are a tremendous way. Or if you go on the internet, you can find a lot of companies, even Target, that have small HEPA filters for as inexpensive as $35 up to $500, right? So, or really up to $5,000. So the two things I've been told employers is look at purchasing a HEPA filter if you can, and hose down your facility, your screens, to make sure. Another thing they're saying to do is to clean your windows, because although walls, the viruses may not adhere to a wall, they will adhere to a window, right? And remove any latches that you have from doors, right? One of the things that I tell employers, if you could possibly trigger a door that it can stay open, or make a door a push as opposed to a latch, right? Then you cut down the possibility of infection a lot, because the thinking around that is if you have to grab the latch and hold the latch and push it down, may not work, and you touch your face, touch your nose, then go back and do it again, right? It may be better just for now to remove the latch, put a little pad there, right? And if you say, well, that's how do we do things low cost? Simply remove it and glue a piece of wood or plastic right? Or you go to Home Depot, you ever see the things that stop holes from getting in your wall, the plastic you put on those for the doorknob?
Mm-hmm.
It's a pad you put on the wall and you just stop. You can buy a pack of those. I think it's for $1.49. So you remove the latch, you put the plastic pack right there, and then that pack, in essence, keeps the you from sticking your finger through there, and then you could just open the door, right, without using a latch, right? So anything to avoid any gripping or grasping, and cleaning the windows, spraying down all of the filters and doing a HEPA is really a way. And the last thing is there is a branch of OSHA, and their only deal with adaptations and bloodborne pathogens. So if you simply look into that, or you could search it, I believe it's called NOISH, N-O-I-S-H. Let me see, don't quote me on that, but I believe that's it. And OSHA, right, and I know the time-sensitive ones, you could find that with them, right? Just go to NOISH in OSHA and it will be right there. And they have more resources regarding things like that than you could ever find. And sorry, I went so long.
You know, one of the things, Rodney, that you mentioned that we're looking into, and it's a cost issue for us, but we are looking into changing our keypad entry in our front and our main door and our back door. But here again, that's going to cost about $6,000 because we're looking at having a key card entry that's a no-touch thing where the door opens automatically. And so hands-free, getting in and out of the office. But again, that's a budget issue. And for us, we're looking not only at our headquarters, but all our regional offices to do that.
Yeah, but Angie, I think you just hit the nail right on the head. Anything that you can implement that's zero touch or single touch, right, is going to reduce it. And what I always tell people in webinars or in lectures is this: look at every single way, sit down one day that you touch things, you know, from opening a latch, opening a restroom door, to touching a computer, to getting in and out. List them on a piece of paper, then subsequently reverse engineer it and say, how many of these can I eliminate? I can eliminate the door. I can eliminate lifting of the window. If I don't have air conditioning, I could have the window open and use a screen, have a sign saying that we recommend not touching this and going back and forth. Just looking at everything you could do to promote a no-touch environment.
Yeah. I think that's great advice. And I love all of your DIY approaches too, Rodney.
He's a king of DIY. I love it.
Oh.
Yeah. Regina, I think want to close it out with a few words from you. And I want to prompt you a little bit with a great question from Lawrence. This all seems really daunting. And I'm sure it is for big organizations too, but especially for small organizations that may not have their own HR department. Curious if you can speak at all as we're wrapping this up to what smaller organizations can be thinking about and ways to tackle all of this without just feeling completely overwhelmed on top of, actually, working towards your mission.
Boy, I wish I had a good answer. It's why we're doing these sessions, because the nonprofit sector is used to being pretty scrappy, right? The IT department is the HR department and the payroll department, right? It's just a lot of people multitasking, and it is daunting. There's so much going on. One of the things you guys should know right now, though, is Pyra is also making their sessions free on Mondays, and that is a free resource for HR professionals for now via webinar. And then, as we get templates, Rodney suggested some sites. I know that doesn't help to be searching around, but as we collect templates that we can share with you, we'll keep them on our website, and we'll try and make it easier for you to find. But I'm with you. I think this is so hard, and that's the reason why Rodney's in business, right? These are always changing issues in California, and especially with a pandemic. And we're going to do some stuff wrong. And the county's sending different signals than the state and the Fed, and it's just a lot. So I would say we're really lucky that Angie and Rodney shared their experience. Hopefully, you know, there's a lot of things you can take away from what they suggested today. And, you know, I think what we find with HR people is that it's just really important that you talk to peers. You know, what are you doing? How are you guys handling this? You know, anything that you can do to connect with others that are doing this work.
Yeah, and I want to say this before we close. There is a kind of a resource guide to returning employees back to work with links that I have been using effectively, I think, with my clients. I will share that with you guys at no cost, and you could go ahead and share it with your employees. And I think what it will do, or your members, stakeholders, because what it will do is it will eliminate the double information syndrome that occurs with Google, right? This is vetted information. So I'll share that with you, and it has pretty much most of the links directly that you need, right? And as things come up, I'll continue to share them so that we can get through this together.
That's great. Thank you, Rodney.
Awesome.
Really appreciate that.
Regina,
Thank you to everybody. Thank you,
if
Angie.
you need I can share with you kind of a template of our internet and cell phone agreement and our telework and remote agreement that folks may be able to fashion for their own organizations.
That's great.
Awesome.
That's really
If
great.
you guys
Very
could share
generous.
both of those with me, I can share them with everyone who's on the call today, along with the recording and the slides.
Okay, great.
So we're getting lots of thank yous from our audience to you guys. So really appreciate it. Remember, it's a long weekend. So HR people know you guys need mental break. So do something for yourself this weekend.
Well, we'll do it. I appreciate you guys for having us, and I'll get that out. Aaron, you want me to send that to you, or?
Yeah, that'd be great. And then I can share with everybody else. And I'll be sure to share Angie and Rodney's contact information, if that's okay with both of you.
Yeah,
Gonna come messages
Yeah.
asking.
I would love to get hold of
you
you.
guys further.
We have a lot of mutual contacts.
Great talking to you all. Thank you so much.
Bye-bye. Take care, everyone.
Thanks, everybody. Have a good weekend.
Bye.